Hi everyone, my name is Neil Singhavi. I'm the CEO of LinkMD. We are building the agentic AI ecosystem for revenue cycle management for healthcare organizations all around the country. Today, I'm really excited. We have a great panelist, a very diverse panelist of specialties, as well as young people who are going to be the future of medicine. AI is coming in hot in healthcare. We can see that, but what does that mean for doctors in the front line? How is AI changing their daily practices? What are the challenges that still need to be solved? And what is their outlook on AI over the next 5 to 10 years? So introducing Dr. Manali Shah. She was born and raised in Phoenix, Arizona. She trained extensively across the Midwest. She completed her medical school at SLU, followed by an internal medicine residency at Rush, is now pursuing her fellowship in allergy and immunology at University of Missouri, Kansas City. Throughout her training, she has worked with diverse patient populations, deepening her passions for internal medicine and healthcare equity. And she is committed to ensuring accessible healthcare for all and advancing medical inclusivity. Thank you, Dr. Malai Shah, for joining us. Next, we have Dr. Rajan Patel. He is an accomplished anesthesiologist who blends medical expertise with business insight to elevate patient care. He's a graduate of Marian University College of Osteopathic Medicine. He is currently an anesthesia resident, PGY4 at Kettering Health Network, and he's also headed to Dallas, Texas after his residency for Arlington Memorial Hospital. And now moving on to Dr. Varun Sharma. He was born and raised in Arizona as well, similar to Dr. Manali Shah. He has been committed to serving his community. He attended medical school at University of Arizona, is currently an orthopedic surgery resident at Banner Health, and his passion for orthopedic stems from hands-on experience working on cars growing up. And he's excited for the future of medicine and the role of technology improving patient care. And finally, we have Dr. Puneet Barot. He completed his undergraduate in University of Virginia before attending medical school at VCU. Now he's a family medicine resident at Banner Health, and he traded 4 seasons of Virginia for the desert heat of Arizona. He is passionate for medicine and how it is rooted in building long-term relationships with his patients, helping them manage chronic diseases, and achieving their health goals throughout personalized care. Thank you all for joining us today.
Thank you
for having us.
Thank you.
All right, to kick things off, I kind of want to go into how AI is currently affecting, your daily practice at your organizations. Can you guys maybe talk about, what are you guys seeing in your day-to-day? How is AI playing a factor? And what are your hospitals and organizations doing to implement AI tools?
Yeah, I can start this one. At Banner Health, one of the big things I've noticed over the past few months started off with just simple note writing. I know in the neuro department, some attendings would just on their own have kind of microphones with AI scribes almost to write their notes. And recently, they've started to implement this kind of across all our platforms on Cerner with InNote, kind of an AI software to help us write our notes. So I think as a system as a whole, they're starting to implement it, seeing how powerful AI is as a tool.
I think for me in residency, we used like AI a lot when we had like medical conundrums to kind of come up with like differential diagnoses and potential like diagnostic and therapeutic tools we could implement when we were at a loss. But it felt like it was a very broad type of thing and not tailored to the patient, which made it difficult. And I think right now in fellowship, we're using AI for a lot of our discharge when we discharge patients from clinic. So using AI driven like kind of generic templates for a patient's diagnosis and then giving that to them when they leave.
On the anesthesia front, sorry, Dr. Barot.
Yeah, go ahead.
On the anesthesia front, I've seen it in 2 different aspects. One has been in scheduling, just seeing how surgeons' timelines kind of fall with anesthesia timelines and getting the most usage out of our OR schedules. And then inside the operating room, we've been seeing it used as a predictive analytic for cardiac output, blood pressure, and like preload, and mostly in our cardiac surgeries to see those 3 like aspects of cardiac output and how maybe we can affect each one, whether we're seeing hypotension just because of preload or because of SVR decrease or because of just an absolute decrease in inotropy. It's kind of a work in progress, and it kind of depends on the accuracy of the monitors that we're using for that case. But those are the 2 aspects I can think of.
For me, on the clinic side especially, I'm seeing it more kind of as well with the administrative burden. So it's helping for sure with note writing templates, but taking that a step further and seeing tools like Open Evidence create like detailed assessment and plans has been really useful. And then during one of my radiology rotations, I saw that it could provide a pretty accurate synopsis based on using like large language models to create at least the initial impression for what is normal. And then the radiologist would go back in and just dictate what's abnormal, and seeing their efficiency in workflow was pretty impressive.
Now, going on the flip side, do you guys see where AI is kind of is underdeveloped, or is kind of intrusive, or is not performing where it should be? Have you guys had any instances of that?
I think in general, AI still has a huge language understanding barrier. When you're talking to AI models, trying to ask specific questions, you have to be very detail oriented. So to people who are new to using AI, it can be very daunting, especially with a lot of the tasks that we're trying to ask of it, or ideally in the future would like to ask of it. So I think AI is still in like baby form and has a lot of growing and developing to do to have a huge impact on the medical field.
I briefly mentioned like I think there needs to be a little bit more crossover between biomedical engineering and AI, at least for the anesthesia standpoint, because we have monitors, and how accurate that information is feeding into AI really affects how useful the AI can be back to us. So like that example of cardiac output, like we really don't have really accurate monitors for cardiac output. So if we want to have AI tell us what variables to affect, then we need to get better monitors on that standpoint. That's the big thing I can think of. Also, there needs to be more clinical research in terms of outcomes of whether or not like AI can help us do X, Y, and Z, but is that affecting patient outcomes in a beneficial manner? Because we can put a ton of resources into these technologies, but unless it's in the end affecting the patient in a better manner, we kind of might want to divert our focus elsewhere, maybe towards like patient education or the administrative tasks that you were mentioning as well.
Yeah, it's kind of interesting you mentioned, because I think when you integrate, especially technology, into big organizations that you guys are at, looking at the ROI, or like the key performance indicators of the before and after, are important. Have you guys noticed any big ROI shifts from any new AI practices coming in, or even any new technology coming in at your guys' organizations?
Not much. Oh, go ahead.
No, that's okay. Go ahead.
I was just going to say, I don't have too much insight, at least on the administrative side, to know returns on investment. But I know, talking with you about your product and just knowing kind of background on how billing and coding works, how many individuals are hired for things that still get missed pretty regularly. For example, like you do a whole operative note, you do all these procedures, and despite all of it being in there, we're constantly having to clarify in our note exactly what needs to be billed, why it needs to be billed, and putting a lot more time at the end of our notes to say, this was a level 3 visit, this was a level 4 visit. These are the reasons why we interpreted radiographs, prescribed medications, scheduled surgery. When AI models can kind of read through that note and just know it, and do that in a fraction of the time that it takes any human to be able to do that. And to give us that feedback back, that with these insurance companies, they're looking for these specific qualifiers. So here's what you need to change in your note. That's a next level of kind of understanding that these AI models can do, that our billers and coders aren't really paying attention to, because of the amount of like sheer volume of notes they're having to go through.
Yeah, I was gonna also add, like, again, I'm not sure on like the ROI with AI, because I don't know the administrative part of like the medicine, but I think as like a doctor standpoint, like where I see AI going in the future, like especially helping more with like clinical diagnostics and like starting treatment plans. I think, as Dr. Patel mentioned, like knowing the clinical research behind it, like if we're implementing that in our day-to-day practice as physicians, like what is the benefit to patients? Like, are we improving patient outcomes? Like in my clinical practice, like, am I reducing the number of asthma exacerbations per year? Am I reducing their oral steroids that they got for their asthma exacerbations? Or like in the OR anesthesia, are we reducing their like risk of like all-cause mortality or things like that? Like, I think more patient-driven outcomes, because that's like as physicians, when we look at the data of like a new medication helping, a new procedure, whatever it is, I think we look more at the patient side of it. So I think that's kind of also where the AI could be a lot helpful too.
One thing to note, especially like in primary care, kind of being on the front line and not only being there as like a bottleneck for referrals, but building trust with the patients. I think AI is still in its infancy, as Dr. Sharma mentioned. Being able to record a conversation, but then what does that entail as far as liability? And then additionally, if a patient comes in, briefly mentions that they have chest tightness, but we don't really delve further into it, go on and the patient has a poor outcome, who is held liable? How far will AI go as far as dictating that into the chart? So in certain ways, I do find that it is still early on. But even now, I'm having patients that will come to me and be entailing that, okay, I've already put my labs in Chat GPT and this is what it recommended. I just wanted a second opinion. So it's very exciting, but also interesting to see where we are kind of at an inflection point as far as where AI is going. But for me, I think the biggest caveat and the biggest kind of bottleneck that I see is just building that patient trust moving forward.
And I think that ROI can kind of come in a lot on like the supply chain side, or like I mentioned, where you're kind of using the scheduling of, because every surgeon kind of has how, the fast surgeons, the slow surgeons, the procedures that tend to run long, like an X-lab versus like if you have an ENT doctor, like who's really good at thyroids, who's really good at like ear and nose and throat kind of surgery. So when AI can kind of read, oh, this is a surgeon, this is the block time that they tend to use. So we can kind of give them this room and slot them in. The OR is so expensive. I think the ROI on that can be really huge because now you're affecting multiple service lines, multiple levels of like the healthcare facility in terms of like even just cleaning, circulators, anesthesia, surgeons, scrub techs. I think there's a huge ROI on that. And then also just like supply chain management of an entire hospital could be really optimized with AI. Because right now you have multiple teams kind of discussing, fluids or medications, pharmacy, kind of communicating with everybody else, but AI can kind of delineate into where there's a shortcoming or where there's a bottleneck, and where you kind of need to fill that gap in. I think there could be a lot of learning that way.
I agree completely with Dr. Patel. I think looking at the two sides of healthcare, right, you have like surgery and you have your medicine side. For the surgical aspect of everything, I think it's going to take more of an administrative role, boosting efficiency, kind of monitoring places where we're losing money. And I think that's huge to healthcare systems.
Yeah, and Dr. Sharma, I think we've had discussions about this in the past where, a lot of doctors, they don't feel like their billing is, properly or accurate, especially with some of these organizations. They spend so much money and so much overhead on, staff where they're doing this billing for all these procedures, but then it's not being reflected. The surgeons are not happy a lot of that. Do you see AI coming into factor, or at least I think you briefly touched on it, on automating the coding, giving you guys, the recommendations. This is how you need to optimize your note. Here's maybe something that the insurance won't like, will like, etc.
Yeah, I think AI has a huge impact on that. Right now, instead of writing our note exactly how we should be writing it, we have to take out time to specify, in our assessment plan, that final portion of our note where we give, like, this is what we're going to do for these reasons. We're having to write, like, very clearly why things should be billed certain ways, why certain codes are being coded the way they are, when in reality, that is the job of a biller or a coder. But a lot of times these are missed, and there's a lot of nuances with insurance that, you may send something that doesn't get approved by insurance, and now you have X amount of time to fix that. Otherwise, you just don't make money for what you did. So there's a lot of money being missed for surgeons, for physicians, for procedures that they're completing, just with all these kind of nuances that you have to go about, red tape with insurance companies, and little things, phrasing something differently or specifying with a certain word what you did to qualify for a certain code. So I think just AI being able to bridge that gap is huge, and being able to learn from how we're writing surgeon to surgeon, knowing all those qualifiers. I know for orthopedics, every year they kind of change CPT codes. And there's multiple different organizations that say you're allowed to bill these specific codes for this procedure. You can't double up with certain codes. And there's just tons of information that for a surgeon, and doctor in general, you're focused on your patients. You're focused on providing the care that's needed. And these things get too much in the weeds, and having something like AI to be able to bridge that gap and provide us compensation for things that we're doing that usually just gets thrown under the table, gets bumped out because insurance is obviously a business too, trying to save their money. Um, I think having that AI there is beneficial, it's crucial, and it's the future.
Yeah, no, it's very interesting. I think all those guidelines that are coming out, right? CMS, AMA, every year there's new codes, new guidelines, new bundling rules, right? This code can't go with this code, but these documents, they're over 1,000 pages long. I mean,
Yeah.
I don't see how we expect, us to keep this informational knowledge up every single year. And I think I completely agree. AI being able to ingest these guidelines and give you guys the information in seconds, it's going to be huge and definitely game changer in the billing perspective. Kind of moving on, right? We talk about inefficiencies now, right? And administrative burdens. Are you guys seeing AI in your respective fields solving administrative burdens, whether it's note taking? Dr. Patel, you mentioned, scheduling, etc.
Yeah, I think that scheduling side has been really nice. In our hospital specifically, we had several service lines go through some significant changes in terms of what group was being working at our hospital on the orthopedic and cardiac side. So being able to learn AI, kind of learn how the doctor works very quickly versus us needing months and months of data to see, hey, this surgeon tends to need this time slot or for this long. I think the AI has been able to pick it up a lot faster, and we've been able to acclimate to these new providers much faster and have less wastage on the OR side.
And the clinic side for us, really piggybacking on what Dr. Sharma says, the redundancy in the medical field is one of the most prominent inefficiencies that I experience. We ask patients to fill out intake forms on their phone. They come into the clinic. Again, they have to write these on paper charts. The medical assistant goes in, and then I go in and ask the same questions, more or less. And the patient, some oftentimes very frustrated that they've already answered these questions. That why are we still kind of discussing moot points that they don't want to continue discussing, and we're already running behind in clinic. So I have seen that AI tailoring those intake forms and creating nice little snapshots or summaries with certain recommendations has been extremely helpful. And then as far as the billing and coding side, the redundancy as far as needing to bundle certain codes in a certain manner, having to perpetually edit the note in order to provide reasoning for your documentation and why things have to be documented in a certain way. It really takes away from good patient care. And as Dr. Sharma mentioned, this is something that billing and coding expertise is needed in, but that's not something that's within our wheelhouse that we should constantly be updating. So we always find that beneficial as far as AI being able to transition that entire patient care journey. And you realize that we're leaving a lot of codes unattended for or undocumented because we simply either don't know that they exist. If it's an annual Medicare, Medicaid wellness visit, but we're also addressing acute concerns, then these are things where physicians are often feeling burnt out because we simply do not know what or how far we can code into.
Question I have to you guys is, it's great. AI has been coming in. You guys are seeing the impacts already. Do you guys see, like, what are the main barriers, if on your perspective, when you're looking at AI, right? Is it trust? Is it cost? I know, Dr. Patel, you mentioned, what are the actual outcomes from this, right? What's the research behind it? Or is it just overall the workflow integration? How will this fit into my workflow easily? What do you guys are looking at, when assessing what are the risks of bringing on an AI tool or using a tool?
For me, what I see as a barrier, really, as you mentioned, is integration. So already within these very clunky, outdated EMRs or electronic medical record systems, having to have another tab or application that you have to open up. Then you have to integrate within the existing EMR. There has to be cross communication. In the end, is it going to create more work for me? That's always my thing is, am I going to actually be saving time, which is, I feel, our most valuable asset in these situations. And that time is that we can buy back for ourselves and for our patients. So I think for me, one of the biggest concerns I have as far as the future of AI is integration within our already existing systems, or do we need to start from the ground up and build a separate system altogether? And then the other thing I would mention as far as AI is the source. I think there needs to be like a central body that really vets the sources that go into these large models that we start to use, and make sure that there are large scale studies, like Dr. Patel mentioned, that are we actually making a difference as far as healthcare outcomes? Are these patient oriented outcomes or more disease modifying outcomes? And what are the long term kind of sequelae or results, and are patients benefiting from it? So I think that's going to be interesting to see as we gather more data over the next 5 or 10 years.
Yeah, I think I would repeat kind of a lot what Dr. Barrett said, and also just how, like you said, what resources are we using as that source for AI's information? And I think it's just going to be a time thing. It's an inevitable aspect in our field, but we're going to be kind of bottlenecked by how good are the tools that we can create as far as monitors, as far as just feedback in terms of like negative feedback and closed loop communication between AI, and then the clinical studies, because those are going to take years to get done, and you don't just want like a single facility. You'd want a multi-center study. You'd want a big sample size. So all that stuff takes time and resources. As long as we can kind of be full on in educating AI with that information, then I think that would be one aspect that will decrease the slowdown of that whole process.
Yeah, very interesting. And then have you guys had any examples where an issue had happened that could have been clearly avoidable with AI? For example, a prior auth was taking so long, the appeal took forever, the patient's care got delayed by more than 3 weeks, or for example, some missing documentation happened, could have easily been avoidable, or when monitoring anesthesia, something happened, but AI could have been monitoring it, and something could have been easily avoidable that happened. Have you guys had any examples, or feel like these things can easily be avoidable from AI?
I think you and I, Neil, have talked about a big thing. When we're getting patients prepped up for surgery, we have PAs or us ourselves call the patients, make sure they're getting their pre-op checks, they're meeting with their primary care physician, meeting with their cardiologist, getting all the clearances, they're getting the scans done. And a lot of times these things get mixed or missed. It's a lot to keep track of, a lot of patients. And then come time for surgery day, we have to cancel, certain things weren't met, certain requirements weren't met. And that in itself, it's a burden on the patient for time. It's a burden on the hospital because they're losing money from scheduling out that OR, waiting for that, and now you're not using that. Staff are now kind of sitting around when they could have been doing something, helping a patient, kind of making money for the hospital too. And we were talking about the other day, you brought up, having AI reach out and have these reminders, talk to patients, kind of be there to answer these questions that like, okay, where do I need to go for my imaging? What imaging do I need to get? What medications do I need to pick up? What are the instructions for the day of surgery? Do I stop eating at midnight? Am I able to have some water in the morning? Things like that, when you have 10 cases in a day, where we're kind of monitoring things for 4 different surgeons, each with 6 different cases, that's a lot of patients to keep track of per day. So I think that's a huge place where AI could just help and avoid these cancellations, or help us schedule better, kind of like what Dr. Patel was mentioning earlier too.
I think a big thing.
Go ahead, Dr. Shah.
I send so many prior auths a week for biologic agents, for immunoglobulin replacement therapy, for immunosuppression medication. And it has delayed not even weeks, I would say months of care, because there's just back and forth communication. Our prior auth pool is huge, and we just don't have the staff of nurses to get through it. So having that would be super helpful. And like I said, something we need from the provider, like more documentation of why this patient needs this medication, things like that.
For me, a couple of use cases that come to mind. I just started my obstetrics and gynecology calls this month, and the fetal heart tracing monitoring is something that we constantly have to check during labor and delivery. It's it's a little more subjective, and I think it's something that can be easily made more objective, especially with the data that's provided. And then AI could help us dictate, okay, this is a category 1 versus a category 3. This is appropriate, inappropriate. If it could even pool, sample studies to see, okay, this percentage of the time, the outcome is that we go to natural delivery versus C-section. And then continuing to monitor or making recommendations as far as like inducing or augmenting labor. I definitely see AI playing a huge role there, especially with how heavily litigated the field of OBGYN is. I think it would actually protect doctors a lot in terms of the decisions they make and sometimes the outcomes that they have to live with. Another area where I definitely see AI playing a pivotal role is the prior authorization space. So much of our time, especially like Dr. Shah mentioned, it's incredible, but also egregious how far insurance companies will take it so that we are unable to provide even just the basic standard of care. I can't even order A1C on certain patients until I prove that they have had a basic metabolic panel that shows hyperglycemia. And we already know that a year ago, their A1C was 13. Furthermore, they won't be able to approve common medications like these GLP-1 agonists that we see so many commercials for, even during the Super Bowl. Patients are willing to pay $1,200, $1,400 out of pocket because insurance is not covering these medications, even though we have at least 3 medical indications for it and multiple off-label uses. So I do note that it's going to help patient outcomes in the long term.
Yeah, and just to come full circle with what Dr. Sharma said, I feel like with anesthesia, it's such a challenge where we have 1 touch point, maybe 2 touch points with the patient. And like he said, the patient has so much to do before they come to the OR. Yeah, you're seeing your family doctor hopefully at least once a year. You're seeing your anesthesiologist only during the time where you're getting surgery, and that's very rare in your lifetime. So to educate a patient on all the needs of the OR, set like expectations of the OR, is very unrealistic to happen in just a pre-op timeline. And by that time, like Dr. Sharma said, it's too late to stop a cancellation. When they come to pre-op, they're either going for surgery or they're not. And that is a huge burden on the patient because surgery is very high anxiety. You're setting your expectations to have surgery and then you're canceled at the last minute. That's a huge burden on the patient's just psyche. Also work, they're taking time off of work. Now you're usually expecting to take two weeks off, and now all of a sudden you can't get your surgery done. You're gonna have to take another 2 weeks off. And then on the hospital side, like I said, the OR is billed in minutes on multiple service lines. So any time lost there is a huge cost to the patient, to the hospital, and to the providers all involved. And the amount that we can minimize that with AI, like you said, with like a simple communication program where they can ask their questions. You can't call a nurse line to ask, hey, when do I need to stop my anticoagulants, or when can I stop eating, or just set expectations. That's just a huge burden on personnel. But we've seen how ChatGPT and language models communicate well, and as long as they have good baselines of information, which a lot of this is just protocolized anyway, so it's pretty reliable for AI to be able to communicate that information to a patient. It would be super helpful and just beneficial on multiple levels.
No, that's really interesting. I think as I obviously look into what you guys are planning to do in your future, private practice always comes into mind, right? So have you guys ever thought about when you do look into opening private practice, where do you guys feel like those overhead costs, because the overhead cost when you start a private practice goes into the millions of dollars, right? You guys feel where AI could come in and that overhead cost could be reduced, right? Whether it's needing this amount of staff, whether it's, needing an external company to do this stuff. Where do you guys kind of see that coming to fit?
From a clinic perspective, like from intake, when they take vitals and room the patient, to discharge, get them all their discharge paperwork, to nurse tasks. Like when I think in my clinic, like all the nurse tasks, like again, it just comes a lot of the prior authorizations, sorting through inbox messages, sorting through what needs to be high priority. Like if AI can take care of that and navigate those administrative, like computer things, I can have more challenges happening, like food challenges, drug challenges, and my nurses can supervise that, because that's where I need a nurse to actually do, not this like computer burden. Having AI do notes, then I can have more time to see patients. So yeah, I think like Dr. Sharma said, just like full circle, I think there's so many parts in private practice that AI could be used.
One thing I noticed, a big theme kind of talking through this, is research, right? And all doctors throughout, we're guided by our research. We're research-based medicine, evidence-based medicine. Everything has been kind of done, randomized control trials, looking through the evidence. And I think that's going to be one of the biggest things, is guiding our care for any individual one of us, or even a big group of doctors, to read through all the papers that have been produced for your specific field is an impossible task. It can't be done. And to look through all the data of all patients in a specific system, for example, Cerner for just Banner Health, it's impossible. But this is possible with AI. If you can get an AI hooked into your EMR, be able to look at it, and then you can just ask these simple questions. If I'm using intramedullary rods with blocking screws at these specific quadrants, is it better than using it elsewhere? That's something AI can quickly answer for you, provide you all the data, show you the long-term follow-up, and from start to finish, identify your patient pool, analyze the data, and give you an answer. For us, that's years and years of research. That's a task that takes time. And I think that is going to be a huge part of our future, is AI helping us guide our care, providing that evidence to us, something that is a much higher level type of deal, something that we can't do on an individual level.
Yeah. And I think AI cannot replace the critical thinking that you develop by going through so many years of schooling and training, but what it can augment is your ability to provide real-time interventions and changes based on evidence and data that it's been fed. But I think the biggest caveat here is making sure the information that these models are trained on are fully vetted. They're coming from longitudinal studies that are randomized control trials, that have evidence-based medicine kind of at the forefront. And then, there's no limit to, how good of care and the latest kind of, treatment plans that we can provide for our patients.
Yeah, in my field, I think I'm most excited about how AI can integrate different variables. Because like Dr. Barrett said, like the decision making is always going to fall on the physician on where to direct care. But for example, like in the OR, like running a simple drip, is the one variable that I can run is weight-based dosing. But AI will be able to augment what information I'm able to use in choosing how fast I want to run a specific sedation infusion or pressor infusion, besides just weight. Just recently I read a paper on how they're trying to find ways to use height, weight, age, sex to determine, pharmacology and what I can change and take better care of the patient that way. So I'm just excited for AI to bring more information at my grasp because, we can only digest so much just looking at it. But if you have a good software and a good UI, you can quickly put multiple variables together and make your decision making more powerful.
And I think when I look at, especially when people are going private and all these like use cases you guys mentioned, all the way from, scheduling, pre-op compliance of the patient, the coding and billing, the note taking, and even getting the claim submitted. I do feel like at this point now, when you look at that administrative burden, or even like, again, prior auth in the beginning, patient eligibility, all that stuff should be automated for you guys at this point. And then I think everything goes back to, enabling you guys to provide, value-based care. Where if you're doing all these things, that's kind of hindering what your guys' main focus is, which is what the patients need. So I definitely see, all these administrative tasks being kind of automated and kind of upskilling any of the workforce you have on there, or even, completely, changing the way private practice is done. So very exciting for that.
I think it's going to let us do our jobs and just be doctors that provide care.